Assessing the sensory-neurological system.
Assessing the sensory-neurological system. Examination of the sensory-neurological system includes assessment of mental status, cranial nerves, reflexes, sensory function, and motor function. The purpose of this procedure is to determine if sensory-neurological system functions properly. Equipments to be used: cotton whisk, cotton applicator, substances to smell, wristwatch, water, penlight. Considerations before, during, and after procedure. Identify client and explain procedure. Perform hand hygiene. Make sure client is comfortable throughout the process. Document all findings. Things to document after the procedure. Observations, findings, either normal or abnormal. Okay, so let's start with a sensory function test. Introduce self and verify the client's identity, explaining the procedure to the client, provide privacy. This is to gain cooperation and lessen the anxiety of the client. Good day, ma'am. I am Nurse Rahma, Naim, your nurse today. I am going to assess your sensory-neurological system. Are you a Miss Imam? Is it okay to ba mo na i-assess ko yung sensory-neurological system? Perform hand hygiene and observe appropriate infection control. This is to minimize contamination. The client's eyes should be closed whenever possible. Testing should always be bilateral. This is to provide baseline assessment. For the light touch sensation, ask the client to close her eyes. Let him respond yes or no when he feels the cotton whisk touching his skin. With a cotton whisk, lightly touch the specific spot and then the same spot on the other side of the body. Ask the client to point the spot where the touch was felt. Ma'am, ito makabuan di kailangan niya blanco. Ma'am, close your eyes. Sensitivity to touch varies among different skin areas. This demonstrates whether the client is able to determine tactile location. For the normal findings, light, ticking, or touch sensation. Abnormal findings: anesthesia, hyperesthesia, hypoesthesia, or paresthesia. For the pain sensation, ask the client to close her eyes. Let him respond sharp, dull, or don't know when he feels the sharp or dull end of the safety pen or needle is felt. Alternately, use the sharp and dull end of the sterile pin or needle to lightly prick the hand, forearm, abdomen, lower leg, and foot. Do not test the face. Allow at least 2 seconds between each test. Normal findings: able to discriminate sharp and dull sensation. Abnormal findings: areas of reduced, heightened, or absent sensation. Mark them out for recording purpose. Ma'am, kailangan mo ba sharp, dull, or no? Close your eyes.
Dull. Sharp. Sharp.
For the kinesthetic sensation, ask the client to close her eyes. Brush the client's middle finger or big toe by the sides and move it up and down. Have the client tell you the orientation of the middle finger or big toe. Normal findings: can readily determine the position of fingers and toes. And for the abnormal findings: unable to determine the position of one or more fingers or toes. Close your eyes and i-identify mo saan ko i-touch yung
Middle toe. big finger.
Very good. And for the cranial nerve assessment, olfactory, cranial nerve 1, test sense of smell on each nostril separately. Have the client occlude a nostril and use a various scents. Repeat with the other nostril. This is to assess the sense of smelling of the client. Optic, cranial nerve 2, check the client's visual acuity using the Snellen chart. If the client uses eyeglasses or contact lens, let him wear it. Test the visual fields. Let the client follow your finger coming into the visual field from all directions. This is to assess the sense of sight using the vision and visual fields functions of the eyes. Optic and oculomotor, cranial nerve 2 and 3. Check the papillary reactions to light in both eyes. This is to assess the papillary reaction to light of both eyes. Oculomotor, trochlear, and abducens, cranial nerve 3, 4, and 6. Ask the client to follow your finger as you trace a letter H in mid-air. This is to assess the motor skills of the eyes. Ma'am, draw the trace on the letter. Okay, very good. Trigeminal, cranial nerve 5. Ask client to clench his jaw. Feel for strength and both of the temporalis and masseter muscles. This is to assess the muscles of mastification and sensation of skin or face. Trigeminal and facial, cranial nerve 5 and 7. Check the corneal reflex by lightly touching the cornea with a wisp of cotton. This is to assess corneal reflex. Facial, cranial nerve 7. Ask the client to raise his eyebrows, to close eyes tightly, pull up cheeks, smile, frown, and show teeth. This is to assess the facial nerves. Ma'am, raise your eyebrows, close eyes tightly, puff on cheeks, smile, frown, and show teeth. Vestibulocochlear, cranial nerve 8. Test hearing by whispering a word or holding a ticking wristwatch into each ear. Do the Rin and Weber test as well. Ma'am, cover mo yung one ear mo. Then, dalawang natin na i-direct ko na kami. The weather is hot today.
The weather is hot today.
Then, let me see. The weather is cold today.
The weather is cold today.
Okay, very good. This is to assess client's hearing. Glossopharyngeal and vagus cranial nerve 9 and 10. Assess and listen to the client's voice. Have the client drink a glass of water. Check if the ovula is midline. Have the client say ah. Observe if the soft palate rises evenly. Check the gag reflex. This is to assess swallowing ability, tongue movements, and gag reflex. Accessory cranial nerve 11. Have the client turn his head against resistance and to shrug his shoulders against resistance. This is to assess head movements and muscle strength of the neck and shoulder. Hypoglossal cranial nerve 12. Observe the client's tongue for any atrophy or fasciculation. Have the client stick out his tongue and check if it protrudes midline. Have the client press his tongue on the insides of his cheeks. This is to assess the motor skills of the tongue. Mom, say Okay, next is document findings in the client record using forms or checklists supplemented by narrative notes when appropriate. This is for record of data. And lastly, report deviations from expected or normal findings to the primary care provider. This is to communicate with other healthcare providers.